Hello, welcome, boys and girls across Osceola County and across the world. My name is Christopher Tolliver. I am the STEM Mobile Lab Specialist for the School District of Osceola County, bringing you another Virtue Live field trip here at Advent Health Celebration Hospital. Just a little bit about the stream. If you look in the description below, there is a survey that I want you all to fill out. If you're viewing this, you fill yourself out and get a chance to earn some really awesome prizes provided to you by Advent Health Celebration. So today we've got a really exciting thing that we're going to do, and I'm going to toss it over to Aaron to introduce who we're going to meet and the careers that we're going to explore today. Aaron?
Great. Good afternoon, everybody, and welcome from Career and Technical Education. Thank you to the Education Foundation for making this all possible through the medical pipeline. We're very excited here that Advent Health is allowing us in today to see a very special part of the hospital. I want all of you today to think about, if you're getting into healthcare, what are some of the things that you're going to see today that interest you so that you can go back and talk to your teachers about it. You're going to see many different job roles today, but we're excited today because it is Red Day. It's Heart Month. So we're talking today about being around when patients come into the hospital and there's something going wrong with their heart. I'd like to introduce you today to our first guest, and that is...
Hi everyone, my name is Vanessa. I am a registered nurse, and I've been a registered nurse for 17 years now. Most of my career has been in cardiology, about 10 years, so I'm very excited to be walking you through what I do as a registered nurse here at Advent Health Celebration and the pre-operative and post-operative department in cardiology.
Thanks, Vanessa. Can you tell me a little bit how you got to be a nurse? What kind of schooling did you have to go to?
Yes, so I had to go to school for 4 years. I obtained my bachelor's degree, so I went to school for 4 years straight, and then I went into practice, and several years later after that, I went back to school to obtain my master's degree.
Great, thanks so much. Well, tell us a little bit about what we're going to see today in the pre-operative area when someone comes in and something's wrong with their heart.
So in the pre-operative area, what we do is we get patients ready for the procedure. We make sure we talk them through what to expect. And also, I have to do a little hands-on of starting their IV, drawing their blood work, as well as getting them on the monitor and making sure that they're ready for their procedure during the day.
Great. Can you show us some of the things that you have here that maybe a patient would see, or some of your job roles in using some of the things on your table? And I'm going to move out of your way.
Yes, definitely. So we always put a blood pressure cuff on a patient so that we make sure that their blood pressure is within range. Too high of a blood pressure could cause, or too low of a blood pressure could cause for a procedure to be canceled. We also have a pulse oximeter, short. What term we use is pulse ox. We place that on their finger to see how well they're oxygenated. Also, we have some EKG patches that we place on the patient to take a look and see what their heart rhythm is. Because as you know, or may not know, that we do have abnormal heart rhythms. So we want to make sure that we can see on the monitor what the patient is doing for the day and make sure that they're stable enough to go for their procedure.
And where would they see when they use these? Where would they see that their heart rhythm? How do you know that their heart rhythm is okay?
So I have to go through specialized training as well to make sure that I go through an EKG class to make sure that I can read the rhythms in cardiology. And when we place the stickers on the patient, that's really showing us on the monitor what the electrical activity of the heart is doing. When they're going for their procedure, we're looking at the plumbing part of their heart.
Great. And does it show right there on that screen over there?
Yes, it definitely does on this Philips monitor that we have in our pre-op area.
Great, thanks. What else do you have?
I also have an IV start kit because we do have to start an IV for their procedure. The reason that we do that is we want to make sure that they're comfortable for their procedure by giving them medication to help them relax for the procedure. But before that, once I start their IV, I also have to get blood work. Blood work will allow us to see that they're doing fine and that their potassium and electrolytes are within normal range, and that also that their blood is also within normal range so that we can proceed with the procedures. Anything abnormal range, we would definitely need to notify the physician about.
And where does the IV actually go? What are you doing with this?
So the IV actually goes in an arm. Usually we like to go mid-arm to their wrist or hand area. And so this goes into a vein.
Thank you.
And we have different sizes for the IVs that we would use. With experience over the years, you'll be able to tell which IV you would use on your patient. I also have here a consent form. Before we touch and put hands on a patient, we need to make sure that the patient knows why they're here and what they're getting done, and that they're agreeable to the procedure, so we would have them sign a consent form. I am going to walk you through what I do on my typical day with a patient.
Great, thank you, Vanessa. You're welcome. So what did you just do there?
I just foam my hands. Anytime I go into a patient room or exit a patient room, I want to make sure that I'm foaming my hands to ensure that I take off any kind of bacteria that I may have on my hands. I'm also going to put my gloves on. And I'm going to introduce myself to the patient. Hi, Ms. Roberts. My name is Vanessa. I'll be your nurse for today. How are you doing?
I'm well. How are you doing?
I'm doing great. Thank you. I'm going to get you ready for procedure. Do you have any questions for me?
No, I'm okay.
Okay. Before I place any items on you, can you please tell me your full name and date of birth?
Julia Roberts, 1/1/2000.
Thank you so much. And I see here that you're allergic to medications. Is that correct?
Yes.
Okay. And what would that medication be?
Penicillin.
All right. Thank you so much. What kind of reaction do you get with penicillin?
My throat closes up.
Okay. So that's a real bad reaction. So we're definitely not going to use penicillin for this procedure. I'm going to go ahead and get your vital signs and make sure that everything's going okay with you. Okay?
Can you talk to a little bit about what vital signs are and why you do them?
Yes. So when I start putting these patches on Miss Roberts, definitely for this procedure, we have a specific location that we'd like to put these. We put one on the right arm, one on the left arm, and then 3 on the left leg. This will give us the heart rate. A normal heart rate for an adult would be anywhere from 60 to 100 beats per minute. I'm also going to get a blood pressure on Miss Roberts to make sure that her blood pressure is stable for procedure. As noted before, anything too high or too low can prevent us from proceeding with procedure. I'm also going to put a pulse oximeter on Miss Roberts to make sure that she's oxygenating well and she's not having trouble breathing. All right. So for this procedure, the reason why we go ahead and put these on the leg is because I'm going to have to get you prepped for your heart catheterization today. And usually the physician will either go through the wrist or both groin areas. So I am going to go ahead and shave and get you prepped for this procedure and shave your wrist area and both groin areas. Okay?
Why would you have to shave a patient before a procedure?
Good question. The reason why you would have to shave a patient for procedure is that you want to prevent any kind of infection. So you want to make sure that you get hair, any kind of hair off the skin, and make sure that the skin looks good and is normal and not reddened so that you can proceed with the procedure.
Great, thank you.
You're welcome. So Ms. Roberts, I have you hooked up here. Everything's looking great. We're going to go ahead and get you shaved for the procedure and also get your IV started. Okay. All right, Ms. Roberts, are you squeamish in needles? No. Okay, I will do my very best to get you on the first try. Okay. Okay.
Vanessa, how long did you have to train to learn how to put in an IV on someone?
So I did on-site training and also did taking courses to make sure that I am proficient in starting IVs.
And that was part of your nursing training?
Definitely, yes, it was part of my nursing training. And also, someone's always doing your nursing training, precepting you and making sure to ensure that you are taking care of that patient in the right way and that you are not causing any harm to the patient. I'm going to head and stick you, okay?
Okay.
I'm going to also grab your blood work while I'm doing this.
Okay.
I'm going to label your tubes and then we'll get this sent off to the lab, okay?
Okay.
I'm going to secure your IV site. And right now, since you haven't had anything to eat or drink for your procedure, I'm going to connect some fluids so that you can stay hydrated for your procedure. I'm going to come around this corner.
Vanessa, why do patients have to not eat or drink before they come into the hospital for a procedure?
So it's very important that you do not eat or drink for the procedure because you're going to get medication during your procedure to help you relax, and any kind of food can upset your stomach. And so definitely you want to make sure you have nothing to eat or drink so that as you're laying down on the table, because you'll be laying down flat, you don't want to have the risk of having any nausea, vomiting, or risk of aspiration, which is having something go to a different part of the body that you wouldn't want, that can cause some other effects that would not be very good for you. So I'm going to go ahead and hang some fluids just to keep you hydrated for the procedure, and so that they have that so that you can go ahead and get your medication for the procedure. Okay, so now that you're ready on my end, I will make sure that we double check that your labs are looking okay before we send you back for procedure, okay?
Okay.
Let me clean this up. Would you like your family member to come in before they send you off for procedure?
Sure.
Okay, we'll make sure to grab them.
So Vanessa, is that everything that needs to be done in the pre-op area?
Yes, definitely. Now she's ready to go, and we can go ahead and take her for procedure.
Great, let's go.
All right, we're ready to take you for your procedure. You ready?
I'm ready.
Okay.
As we're heading to our next location, I just want to remind everyone to follow the link to the survey below for your chance to win some awesome prizes provided by Advent Health. And of course, hit subscribe so that you never miss a next Virtue Live performance.
So Vanessa, these are all the actual operating rooms?
Yes, there's 2 operating rooms on this side, and then we have 6 packed labs on the other side.
So we're heading to the place where they're actually going to do a procedure, but not actually an operating room, correct?
Correct.
All right, let's check and see if Elmer is here. Hi, Elmer. Our
Hello.
patient is ready.
Hi there, welcome. Come on in.
Elmer, can you introduce us to you? And
Yes.
what we're about to see.
Hello, boys and girls. Welcome to the cardiology department. My name is Elmer, and I'm one of the cardiovascular technologists here in the cath lab. Welcome to the fascinating world of cath lab. It is an amazing world where you will find and learn about your heart and your circulation. Right now, I am wearing my lead apron to get me started with the procedure. This getup protects me from the radiation that we'll be using for the procedure. This is what we need. And over here, you will see me, I will start cleaning my hands with surgical soap. Now this is a very special soap. It has a promethazine, which helps get rid of the bacteria in your skin. So, we'll do our wash. And we take at least 2-3 minutes of washing because we want to make sure that you have our hands really, really clean for the procedure. Okay? Some people will say you can sing a happy birthday song 7 times. That will give you the 3 minutes that you need. So all I'm doing is scrubbing between the fingers and the entire hand. Because as you know, this procedure is very sterile. You want to make sure that there's no skin bacteria that's going to make it through the procedure. Okay? Now wash, get rid of the soap. And then we proceed to the cath lab.
Great, Elmer, we'll follow you.
Yeah. There you go. Come on in to the surgical suite.
So students, make sure that you can look all around when you're on the video, because this camera will let you see this entire room. So it's not just when Elmer's talking.
Right. And right now we just pretend our patient's already on the table. It's already got prepped and ready for me. So what I do now is I grab my towel and start drying up my hands. And this makes it easy for me to put on the gown and the glove that I need for this procedure. And just to let you know, in this cath lab, there's a minimum 4 people that are involved in here. So it's a teamwork. Each member plays a very important role. I am a scrub tech. I will be assisting the doctor in this procedure. Another nurse may be present here circulating, giving medications to the patient, sort of like an anesthesia. And then we have somebody in the control room who will be recording everything, watching the vital signs, and making sure everything's going on correctly. Alright? This is a sterile gown, so you know everything must be sterile. And my circulating nurse will help get it closed up. Now we'll put on our sterile gloves. Go. Ready? Almost. One last thing. Now we are ready. Now before we begin, what we do, everybody gather around and we do what we call a procedural timeout. Wherein we identify our correct patient is really indeed on this procedure. We're doing the correct procedure for this patient, and then all the medical histories were known, any allergies that we need to know are there, and then if everything's okay, everybody agrees, we can then go ahead and proceed.
So Elmer, during this timeout, it is done for the safety of the patient. Is that
Yes.
correct?
That is true indeed. For the safety of our patient and everybody else, we need to make sure that everything is in correct order. Correct patient, correct medication, correct procedure. Yep.
Great.
Okay.
What happens next?
So what happens now, pretend my doctor's already here, our cardiologist, we will call him the captain of the ship because he is the one in charge. I am a cardiovascular technologist. I'm a registered cardiovascular invasive specialist. What that simply means is I go to school. I went to school for a 2-year program and a cardiovascular technology program in any accredited school. That school gave me, equipped me the skills that I need to be in this career. And I can tell you, along the way, I'll tell you how rewarding this career is. Okay? Now moving along. So in this procedure, so we have our patient. We already have him prepped up, draped. Again, just like what I did earlier, we use antimicrobial soap solution to clean the areas, which they have done already prior to covering the patient. So this is make sure that the patient's skin is free of any germs and bacteria that may cause infection. We do not want any infection. Okay, so my doctor is here, and I'm assisting my doctor. I will hand him syringes that has lidocaine in it. What is this? It is a local anesthetic, meaning as you go and work to the groin, there are 2 areas, groin or your wrist. You can work on both axis sides. But most doctors use the groin because it's easy, but newer doctors use the radial approach of the wrist because it's more convenient and then visually for the patient. Now, who gets to do what? That just depends on the patient's anatomy. Some people have good vessels on their arm, some people have better vessels in the groin. So we can work each. Okay, so he will numb up with lidocaine. Right here, just like when you go to the dentist, they will numb up your gum. That way you don't feel the work that we do around. Alright? Once he's done, take away all our sharps, and then he will use what we call an access needle. This is an 18-gauge needle that he will use to poke, meaning puncture and get that access to the artery. You have one big artery right here, open from the legs all the way to the heart.
Eleanor, can you show that needle again? This is how long it is.
This is 18 centimeters, 18 gauge, 7 centimeters long. Okay? And this is enough to get puncture, and the size will be enough for all our equipment to go in. So pretend I'm the doctor. What he will do is get access, right there, puncture. He gets blood return, put it away, and then he will put in a wire, smaller wire right here, flexible wire. Through that needle, we would thread in this wire, and once this wire is in, we will put in what we call a sheath. This sheath allows us to come in, get in and out of all our equipment. They come in different sizes. This is a green color. It says to me, oh, this is a 6-press because of the color. But if you look down right here, we have multiple colors of sheets ranging from different sizes: red, orange, blue, and purple. It just depends on what size we need for the situation, or like what equipment that need to be put in. So since we're just starting the case, we will start with a mid-size, usually 5 or 6 press sheet.
Eleanor,
Yeah?
I have a question.
Go ahead.
So does the doctor decide what size the patient needs, or do you, the technician, decide?
The doctor has what we call a preference list. So what is it that they mostly use on a certain procedure? So it depends on what type of procedure, and that will dictate to us what sheet sizes that we will use. It can also depend on what kind of procedure we will use. If we know it's a more special complex procedure, then we would use a bigger size sheet, because that will allow us with bigger equipment. But since it's just we're starting now to do a diagnostic heart cath, which means we're doing exploratory work. We would just need to take a picture, find out what's going on with this patient's heart.
So in here right now, we're just trying to figure out what's wrong with the patient's heart.
Correct.
Why is the patient having a
That's
particular
right.
problem?
So a patient, maybe you have heard of somebody, your neighbor or even your loved one, complaining of chest pains. Oh, I can't breathe, I'm having chest pains. That is one of the most common symptoms of a person having heart disease. So what they do, they come to cardiologists, they get checked, worked up. And once we found out, you probably need to do a heart catheterization, and then they ended up here. This will be a more definitive test, because right here, we'll be able to take pictures of your heart. Taking 2-dimensional picture of the heart, we take 3-dimensional pictures of the heart as well. So that will give the doctor a very precise diagnosis of what's going on inside your heart.
Okay, so what happens after that?
So if we find out based on our exploration, hey, you have a blockage, then we go ahead to the step 2. We will fix that blockage, which we call a percutaneous coronary intervention.
What is that big word again, you said?
It's called PCI, percutaneous coronary intervention.
Got it.
That just tells me that, hey, one of your coronaries, which is your arteries, have a blockage and we need to intervene, meaning we need to open it up. And I'll get into more details when I get into this special equipment. So right now, let's take some pictures first. So I put in my sheet. Alright. So imagine there's a big sheet, a big IV going into there. Okay? That's in place. So what do we use to take pictures now that I have that big IV on my groin? So now we will have a longer wire that you need to thread into this. This flexible wire, imagine this as a railroad track. So if you have a train, wherever the train needs to be in order to go places, you will have to need a track. So this will be your track for your catheter to move on. So you just advance it enough that it will reach the heart. Once it does, we will go ahead and thread in a catheter. Now, catheters come in different shapes and sizes. We may want to ask why. Why is that? Because everybody has different anatomies. Everybody has different coronary shapes, like this one. It looks like a J hook. It's shaped differently from another one that I have on the table. Like this. Very different. and we have multiple sizes and shapes of these catheters. These catheters allow the doctor to precisely pinpoint and get it engaged in the coronaries, because that's what we want. We want to make sure we are engaged in the coronaries, that way we can take beautiful pictures. Okay, so let's say he decided, oh, give me that JL4 catheter, that will work for our need. So now, as a cardiovascular technologist, I would assist my doctor in getting this catheter into the groin. So all I do is thread it in, making sure that just in case I can just take it like that, and just keep threading it into the catheter. Okay. All right.
Elmer, how long does some of these diagnostic procedures take?
Typical diagnostic procedure takes about 45 minutes to 1 hour. That will allow us time to get all the pictures we need. But if you find out that you have something that needs to be fixed, then of course that will require more time. It can be an hour and a half of time.
Is the patient totally asleep?
Some patients do fall asleep, but our goal is to have them relax, get the heads off. Because we still want them to be breathing on their own, meaning they'll be able to support themselves. On the screen, you will see we have hemodynamics that we call. This tells us and let us know how the patient is doing while we are doing the procedure. We have the electrocardiograms right there, it tells us how the rhythm is. And then the vital signs right here tells us the blood pressure, gives me the heart rate of that patient, how much oxygen saturation she is doing now, and what is the pain level and the respirations. So if everything is going on good, then you can go ahead and proceed.
Is it someone else's job to monitor that, or just the cardiovascular technician?
So everybody's job is to monitor. The doctor may be looking at it once in a while. I may be looking at it once in a while, but we do have a monitor tech in the control room, always keeping an eye on what's going on. So we want to make sure everything's safe for the patient. So they will tell us, like, oh, hey doc, your blood pressure's a little low. So that's Usma right there.
Hi,
She
Isma,
will be-
nice to meet you. Hi.
So she will be assisting us in making sure everything is going on well. She is recording every minute and every details of what's going on in the procedure.
So what does it look like if she notices something not going well? What would Isma do?
So Usma would call our attention. Hey doc, blood pressure is really low, or her oxygen level patient is on the 80s. We don't want it that low. We want it in the 90s, 95, 96% oxygen level. Because as you know, oxygen is a very important medication. Not everybody knows that oxygen is also a medication considered in the cath lab. So we want to make sure that you have ample supply of oxygen as we do this procedure. So she will call it out, and then of course we will help by putting the oxygen in an oxygen basal cannula that would help her get more air in. Because some people tend to fall asleep really bad, so once they really get into that deep sleep, their saturation goes down as well. Okay? Alright, so as we proceed, so now we have this catheter into the heart. So let me go on here to show you what we are talking more about. So now, as you know, your heart has 4 chambers. You have the right atrium, your right ventricle, your left atrium, and your left ventricle. 4 chambers. What does that mean? So you have, in here is depicted as blue and red. Your arteries takes away the blood from your heart and supplies your whole body with the needed oxygen and nutrients. We need that for our everyday movement and everyday living. So once it's all circulated, the veins, on the other hand, brings it back to the right side of the heart and pumps it into the lungs. The lungs then oxygenates that blood. That way it can go back into the heart, freshly oxygen. Now it can be pumped up again to go to the rest of the body, including your brain. Okay? So here, you will see the 2 types of circulation. Your arteries provide circulation away from your heart. Your veins, in blue, provide circulation towards your heart. Okay? So that's the fascinating word of circulation. Alright, so here you will see a catheter that's in place into the heart. And then once we use our fluoroscopy we do take black and white pictures of them, but that's more than enough for us. Black and white picture, as long as it's clear, you will see all the blockages in the picture that we need. So going back to the table, as a cardiovascular technologist, again, my doctor is here, I'm helping him move the table up and down, left to right. It just depends on what he needed to see on this camera. This is a huge camera. We call it with an image intensifier at the bottom. I control what we need to do. You want it left, right, you want it to the head, or to the foot. So, this camera gives me a picture just like what you see here, two-dimensional. But once we move all these angulations, it will give you a two-dimensional picture of the heart. That will give you a clear picture of what's going on. So let's say, looking into that picture, right, so let me go into that side so you can see more. Earlier I was talking about a catheter. This is what you see, that is the catheter. It's like a long straw that goes into the heart. Your heart is this shape. You don't actually see it, but you just see the silhouette of it. And your arteries, particularly your coronaries, sit outside of the heart. So right now you're looking at two primary arteries of your heart. There's three. The left anterior descending artery, the left circumflex artery, and then on the other side is the right coronary artery.
So Elmer, this artery is the blood supply to the heart muscle.
Correct.
So it's on the outside of the heart.
True.
Okay.
So the heart also gets fed, even though he's the one pumping out all the blood. The heart also needs its own nutrients and oxygen. So it gets fed through the arteries that is enveloping the outside of the heart. So like this one, you can see how the blood flow is. One goes to the left, one goes to the front, and then there's another one that goes to the back. That's your catheter. We inject what we call iodine contrast that allows us to see pictures under the X-ray.
So the iodine actually makes it glow so it can be seen.
Correct. The iodine makes it more visible to us. See, like this black fluid, if it were blood, you would not see blood like this. Blood would come on as white. But with iodine, it comes up a dark color, like black like this, and now it will give us a much better picture of how your coronaries are looking. Also in this picture, you see two types of wires that go into those arteries. Again, like I mentioned earlier, this wire serves as a tracking for whatever equipment or supplies that we put in. Okay? And again, with hemodynamics, as we do this, we are also looking at this. So as a cardiovascular tech, you would need education on a little bit of math, and then a little bit of physics, more so physics than chemistry. So if you're fond of physics, this will be good for you as well. And then if you have background in computers, with the technology now, everybody has something to do with iPads and tablets, so this will be easy peasy. So all you need to do is look at the picture, what's going on. It involves logic as well as a little bit of calculation. So here is another picture. So once we get the live picture, we also get a two-dimensional fixed picture of what we're looking at. Okay, going back to the assembly. So let's say I took my diagnostic catheters in and found, hey, the patient may be half awake or maybe asleep, so you can tell them, we didn't find the blockage, now we're going to go ahead and fix it. So when you say fix it, how are we going to do that? Right here again, going back to my pictures. If your arteries, so here's my giant heart right here. So a normal heart, just a trivia, is the same size. Your heart should be the same size as your fist. So if this is my fist, my heart should be approximately this size. So just like this one we have. I have this huge heart just to give you better visualization. The red vessels are your arteries. The blue vessels are your veins. So again, it feds and then it brings it back. If I open this up, like here are your four chambers. Your arteries on the right, ventricle in the right, atrium on the left, and then a ventricle on the left as well. So again, inside, a circulation is going on. That helps pump the blood throughout your body. Okay? Here. So going back here, let's say based on my picture, I found a blockage on one of my major arteries. What do I do now? Like in here, you can see plaque has accumulated. What causes heart disease? Mainly it's atherosclerosis. Big word, atherosclerosis. Simply put, these are lipids, fats that develop inside your arteries and they start to harden. And when they start to do hardening, they become narrow. That narrowing causes your blockers, causes high blood pressure because now your heart has to pump twice the energy in order to get that blood throughout your body.
So Elmer, I think what you're saying is let me make sure I understand.
Yes.
Is that when someone has an unhealthy diet
Mm-hmm.
and they eat foods high in fat,
Right.
it will build up in our arteries.
That's true.
And as that fat builds up in our arteries, it raises our blood pressure,
Right.
meaning our heart has to work twice as hard.
Twice as much.
And
So,
so eventually, something has to be done.
correct.
Okay.
So what are the risk factors of having this heart disease? Well, there are a few what we call non-modifiable factors. It could be your age. Most of our senior citizens start feeling this illness. It could be the genes that you inherited from your parents. So it could be familial history, or it could be modifiable factors, just like your habits, your lifestyle habits. Are you a smoker? Do you drink alcohol that much? Poor diet, or do you even exercise? Are you under a lot of stress? All these factors contribute to a heart disease, and that causes all this to come down a narrowed artery, which causes the blockage, which then give you chest pain, and now you're getting to that heart attack. Remember, a heart attack can be either minor or it could be fatal. So, if you have your loved one or any of your family start feeling chest pain, have them go to a doctor and get checked out. That could be something that needs to be looked at right away.
So
Okay.
Elmer, so if you're doing this diagnostic procedure
Mhm.
and they find that one of your arteries is blocked in
Yeah.
some way,
Right.
can you immediately go in and fix it right then and there?
Yes, that's the beauty of this job. It is outright result. It is very rewarding. If you have a blocked artery, we're gonna go ahead and unblock it. If your heart stops pumping, we're gonna restart it, just like a car. We will go ahead and come back and start pumping. If you have a funky arrhythmia, meaning your rhythms are not that normal, you can go ahead and fix it again. We have other devices that we call pacemakers or defibrillators that can help with that. We also have a smaller equipment that's called a heart monitor that can monitor your heart 24 hours a day, sends the reports it for your doctor to see.
Is this what we call the pacemaker?
Yes, so this smaller one is a pacemaker, so it helps regulate your beat. If your heart is like in a very slow beat or in a very fast beat, then this would kick in and regulate that heartbeat. The other one, the bigger guy here is what we call a defibrillator, meaning this has a more function than that one because it delivers a shock, electrical activity to your heart. So if your heart goes into a very, what we call deadly arrhythmia, this will kick in, shock you, and get you out of that deadly arrhythmia, and get you back to that normal rhythm.
That's fascinating. So
It
you
is.
Can, so you can literally help someone immediately if you find that problem.
Yes, indeed. We save lives here in the cardiology department. Did you know that 30 to 40% of ER admissions are cardiac related? So we have our ER downstairs, and they will always call us and say, hey, we have a patient having chest pain. Bring it up here to cath lab and go ahead and fix that whatever problem he's been having. Most likely a blocked artery.
Well, Elmer, this has been really fascinating. We have about a few more minutes. Is there anything else that you wanted to show us
Right.
before we sign off?
So, again, going back to this picture, how do we unblock a narrow artery? We use balloons, and then we also use what we call stents. So, if I could just bring it closer to you, this is what a stent looks like. The stent is mounted on a balloon like this. Really, really small, because you know your arteries are that small. Once it gets delivered into the artery that we are fixing, it will be inflated. So here, it may come out like something like this. This is a magnified one, it's bigger. But Here's a smaller one. So it comes in size, different sizes as well, small and long. So now your stent, once it's mounted and delivered, it will be something like this.
Now it's really tiny.
It's really tiny because your heart has tiny arteries. But under the X-ray, it can be magnified. So now, once that stent is deployed, you now have a good flow of blood fusing, and you now have a good supply of nutrients to your heart. That should improve your heart pain, your level of energy would improve as well. Okay? Any other question? Yeah?
No, I think that's great. Thank you so much for showing us everything.
Sure.
I'm assuming the patient would then be moved back into a post-operative area to
Yes.
recover and make sure that the patient will be monitored.
Correct. So after all is done, we will wake up the patient and we will be wheeled him into the recovery area to recover for about 1 to 2 hours, depending on the amount of phase that we did.
Well, thank you so much. Thank you
You're
to
welcome.
everyone here. Thank you for coming. Thank you so much.
Yes.
And everyone at home, remember, or in your classrooms, remember to fill out that survey at the bottom of the link, because you have the chance of winning a great prize from this department.
Yes.
Thank you to the Education Foundation and to Career and Technical Education. Thank you to our STEM Mobile Lab expert, Chris. Thank you so much. Join us next Friday. We will be in the pharmacy here at Celebration Advent Health. We look forward to showing you more careers next week. Goodbye, everybody.
But please don't forget to hit the subscribe button so you never miss another video.
Very good.
Bye, everyone.
Bye.